Hello, all. Good evening. Hopefully, I'm being heard. Hope I'm audible. Good evening, everyone, and welcome to the follow-up session of the webinar, of the first webinar from Swasthyam. And yeah, hope this follow-up session too finds you in good health. And I guess these small points, which what we discussed yesterday regarding what is Ayurveda and what the origin of Ayurveda and what are the myths surrounding Ayurveda and what are the common reasons or the most vital reasons why Ayurveda has to be taken up was uh, you know um, it I think it convinced you that Ayurveda is the way of living for all of us. So I request the members, please shoot your questions. You can ask any health query uh, in the chat box, or I think you can unmute yourself and ask as well. But yeah, if you can post your questions in the chat box, I would be very happy to clarify your concerns about Ayurveda or your curiosities about your health, or even the suggestions as to what you might want to hear in the future webinars and what you would like to learn about, and any of these general queries can be taken up. So kindly post your questions in the chat box. We'll be very happy to clarify them, because we have a lot in mind. We really have a lot in mind as to what we have to get to the people regarding health. And there are so many misconceptions, there are so many doubts, and there are so much of misinformations. So somewhere there will be an ambiguity as to what to be followed and what not to be followed. There'll be contradictory opinions. So anything, any the yeah, so anything which can be asked, kindly you can shoot your questions. Any suggestions too, of course. Please ask the questions in the chat box, and we'll be happy to answer you. We'll unmute you and we'll definitely answer them. Of course, in the following webinars, we also plan to bring up many health related topics as to how to understand your health better, how to assess yourself better, and how to know about your health better, whether you're doing okay or not. So we would like to take up that as well in the next coming sessions. Okay, so there is a question in the chat box as to how effective Ayurveda medicines for calf muscle sprain and why. All right. So, sir, the thing is, there are a lot of reason why a calf muscle sprain happens, and depends on the amount of activity you're doing, depends on the season, and depends on what are the reasons for your calf muscle sprain. All right. So, it can be the main reason being the electrolyte imbalance. So it's always better that you get yourself checked as to what is the reason for your calf muscle sprain. It can be some deficiencies, it can be overactivity of the muscles, or it can also be electrolyte imbalances, especially if you're having the tendency to sweat a lot, and if you also have the habit of not having enough hydration and enough water. So that can be a cause, or there are many other underlying causes. All right. So okay. So you had a bike accident is a reason for the injury. So in that case, have you gone for any investigations? That also becomes important. Whether there was a ligament injury, whether there was a muscle tear, there is every chances that there was a muscle tear when you had the injury. So slight muscle tears would keep giving you pain, and until that heals. So it depends on how many how much time has passed since then. And if of course there are very effective treatments for the same in Ayurveda as well. You can definitely consult an Ayurveda doctor, but yeah, generally what would help you as a home remedy would be some pain relieving oil applications with the consultation of the doctor, of course. And in general, if you have not gone for the consultation, then you can definitely use castor oil. Just heat a little bit of what we call the erandathaila in Sanskrit, that is castor oil, castor seed oil. So that you can definitely heat it up a little with by keeping it in a cup in hot oil. Heat it up indirectly, and then you can apply it, massage it over the area of calf muscle pain, and you can definitely give some fomentation with either pouring hot water on the area, or by giving keeping some hot water bag, or some kind of fomentation, some kind of heat application after the oil massage is done. I think this could help you very much. I mean, for temporary pain relieving at least. But again, getting to know the reason as to why there is calf muscle sprain is very, very important. Whether there is, if there is a muscle tear, you would want certain physiotherapies and certain exercises too, for which, and of course the panchakarma therapies which are done under the medical supervision, so you might want that. But as a temporary pain relieving, you can definitely keep some fomentations and restrict the use of the calf muscles if there is a lot of pain, because too much of sudden spasms can happen if there are deficiencies as well. So get yourself checked with regard to the vitamin levels, especially the vitamin B complex levels, vitamin D levels, and and your complete iron profile. So you just have to go through your deficiency profile, just to rule out whether there is any kind of serum calcium, for that matter, electrolytes. So please get these checked if it persists. Maybe sometimes the preceding reason would be the vitamin D deficiencies as well. uh, because vitamin D deficiencies, especially during and after the bike accident, could lead you to these pains. All right. So that could be the reason. So please try the oil massage and fomentation, and restrict the use of the muscles, and then let us know. Yeah, that would be better. Thank you so much. Okay, so we have a next question, that is, how effective is Ayurveda for diabetes? So, Paniji, I would like to say that diabetes is one of the two, condition which can be managed very well with Ayurveda. We have certain detoxification procedures, we have certain medications, and we have some diet recommendations which could definitely take care of your diabetes level very well. All right. But it depends on conditions as well. Like, say, for example, if you have diabetes, if it is diabetes mellitus type 1, it could be insulin dependent. So in that case, it is difficult to help, because naturally the insulin levels itself is deficient. There's no insulin at all. So that case could be a problem. It could take some efforts for intervention and for medicating. But yeah, definitely we can promise the diabetes mellitus type 2, which you can which is non-insulin dependent, which could be because of the insulin resistance it happens, because the body cells doesn't take up the insulin very well, even though the amount of insulin is quite good. It's normal, but still the body doesn't take it up. So that is diabetes mellitus type 2. So if you are above 30-35 years and you have got diabetes mellitus, and yeah, if it is there in the family history, of course family history also becomes very important. Your lifestyle becomes very important. So I would like to say that diabetes is very well managed with Ayurveda. Of course, we have seen I have seen many patients of mine who have gone off allopathic medicines once they have started Ayurveda medicines and regular detoxifications with me. And yeah, you can definitely turn towards Ayurveda. See, Ayurveda and lifestyle disorders have a very close connection, and Ayurveda is the to go system of medicine, I would say, for and the safest system of medicine, I would say, for diabetes mellitus. So you can definitely, because we take care of the sugar levels, we take care of the stress levels, we take care of the food, we take care of the exercise. So yoga for exercise, stress levels with the medications and yoga, and the food with the Ayurveda kind of diet, and the, of course, the medicines and detoxifications, everything work together for the control of diabetes. So Ayurveda is, see, how effective is Ayurveda for diabetes? I would say it is the to go system for diabetes mellitus. So I would say you can definitely go to it. Yeah, so of course, because diabetes, again, it's related to so many things. It is related to your lifestyle. So if you just keep popping in your pills without correcting your lifestyle, without getting off your say addictions, if you have the habit of smoking or alcohol consumption, or if you have a bad lifestyle with stress and staying awake late night and all that, it would be difficult. So Ayurveda gives you a complete intervention. So definitely you can turn towards Ayurveda for diabetes treatment. Thank you so much, Pani. You can get back to me for any other suggestions. Yeah, so we have another question as to, does diabetes heal does Ayurveda heal diabetes type 1? See, I was just telling about that, because diabetes type 1, again, it depends on what age you got the diabetes. If it's from the age of 4, 5, 6 years of age, when you were a 3-year-old child, 4-year-old child, if you have got diabetes mellitus, that is generally when the diabetes mellitus type 1 is detected. All right, so like from the age of 2 3 to the age of 8 10. So this is the common age for diabetes mellitus type 1, because that is genetic. It's completely genetic in origin. It is autoimmune also sometimes. It because your pancreas beta cells are damaged, and it has stopped producing, I mean, it has reduced producing insulin. Your insulin is deficient. So since it is genetic, it is many a times autoimmune, and your insulin deficiencies, deficient, it is definite that we can uh, we cannot, it's very difficult to get you off the insulin supplementation. Of course, we can manage the life, quality of life. We can definitely manage the quality of life, the weight reduction. Diabetes type 1 is again a condition where there is most of the times there is a gross weight loss. All right, so we definitely, it is very difficult to get the person off insulin. I have rarely seen a person who could go off insulin in diabetes mellitus type 1, but definitely the quality of life can be managed. The weight can be, you can give some santarpana to the patient, or some rejuvenating things, and um, okay, so that is about diabetes mellitus type 1. It's a difficult thing to cure, but definitely we can manage. All right, so we have a next question. How about thyroid goiter getting bigger? knowing that T3, T4 and hormones are normal according to blood test. All right. So, okay, so T3, T4 are normal. And see, again here, if you talk about hypothyroidism or hypothyroid condition, or you can, any other related thyroid related conditions, it becomes very important to know what sort of a thyroid condition you have. All right. So is it uh, T3, T4? Which is disturbed, or is it TSH, that is the thyroid stimulating hormone, which is increased at the same time? So you have something called as a subclinical hypothyroidism. You have something, and it also depends on the reason why you have got a thyroid thing done. If it is during pregnancy, because this question is very I think a little vague. I'm not able to understand what exactly you want. You want a hyperthyroid, you have a hyperthyroid condition and you want a thing. Okay, so you said thyroid getting bigger. All right, so it majorly suggests about the hypothyroidism condition, because I think it is so. Again, you have mentioned about T3, T4 is normal, but you have not mentioned what is your TSH like, because TSH is something which becomes very important. The thyroid stimulating hormone is something which becomes very important to get it checked. If that is also normal, then you have nothing to bother about it. But in case that is raised, you definitely need an intervention, you definitely need treatments. So if I take this condition you're talking about is hypothyroidism, then we can definitely treat it with Ayurveda. I have treated, if okay, so if TSH is normal, then what is the problem? I If you have, then we check for other symptoms like weight, we check for a thyroid scan. All right. And we go for a thyroid cytology if necessary. And we also go for a free T3, T4, something called as free T3, T4 is something where T3, T4 hormones, which regulates most of the metabolism of the body, is available for the function. So we check that as well. And we also check the TPO levels, anti-TPO. So that also suggests some autoimmune conditions of the thyroid. So we'll have to get these many conditions checked. And yeah, so we need to get all these conditions checked, and then we'll have to come to a conclusion. But as such, if we are talking about thyroid conditions, wide range of thyroid conditions, then definitely we have treatments in Ayurveda. You can definitely consult Ayurveda, and we treated with detoxifications like Vamana, and we with oral medications and lifestyle changes. So you can definitely consult Ayurveda for the same. Thank you so much for asking that. But yeah, again, thyroid is something which is very commonly found these days. So it is, I think, it's treatable. It's definitely treatable. It is definitely manageable. So we'll okay, so there is a non-cancer. Can you please get back to me about this, ma'am or sir, whoever is asking this? So you can contact me regarding this consultation, because I would like to know more. I don't know what tests you have got done. This is very vague for me. I would like also to know your various parameters of metabolism, how your metabolism is going, how your body is functioning right now. So because thyroid is something which regulates most of the body functions, it's a very important gland. And yeah, so please do contact me. Thank you so much. Yeah, so we have another question here. Can Ayurvedic medicine substitute allopathic medicines such as inhalers? Definitely, sir, definitely. Again, respiratory problems is one of the to go for Ayurveda. Especially we definitely have treated a lot of bronchial asthma patients. We have got them off inhalers. There is no doubt about it. Of course, it depends on various conditions, like from since how many years you have it, and is it familial, you have it in your family or things like that, and since how many, what's your lifestyle like, it depends on various things. But definitely seasonal detoxifications once a year could definitely help you with certain medications, especially in certain seasons like cold season and things like that. It is in fact I would say now, since Vasanta Ritu is just starting, it is best time for your detoxification of bronchial asthma. So you can definitely contact for the same, and you can but I don't know, depends on which city you people are placed in. It's better to just take a consultation once. I think that would work. But definitely any sort of most of the respiratory issues we can definitely treat. I can definitely tell that, because we have treated the allergic conditions, the bronchial asthma conditions, the you know we have got people off inhalers. So especially respiratory related. Yeah, so okay, so I think any other questions you can definitely ask me, and you can definitely contact me even through the app or through WhatsApp for any of the I guess hope all of you have downloaded the app. I sincerely urge you to download the app, and you can ask me any questions related to your health conditions, or you can initiate discussions there. It's basically a forum made for the purpose of health discussions, to make the at least the next generation better with regard to health. So especially with this, of course, I would expect these questions about thyroid, diabetes, and respiratory, because these have become so common these days. It really pains to see. But yeah, so it has become very common, and uh, definitely you can contact me. um, you have a Swastham WhatsApp number, you have app, you have kindly download the Ayurdynamic app, because we have a lot of plans which are coming in Ayurdynamic app, like the forum discussion forums, uh, the webinars, the consultations. We have a lot coming there. So, okay, it is an early phase bronchial asthma triggered by environmental irritants, most probably very recently. Then definitely yes, sir. You can we can get your initial blood work done. We can get your blood tested for the allergy, for the eosinophils and stuff like that, and definitely we can start off your treatment, and you can you can contact me for the same. All right, so because of course it requires certain lifestyle changes too, along with the medicines and detox, but yeah, definitely we can do it. In fact, earlier you consult the better, because some people come after 15 years, 16 years of bronchial asthma, and in that condition it becomes a little tricky. So any other queries, sir? Any other queries which I could attend? Because generally that is what happens with most of the things, like whether it is any condition, whether it is obesity, whether it is knee joint pains, or people come at the later stages, when they are fed up of taking the medications, they are fed up of taking the allopathy medications, they come here, they come to Ayurveda, and they it, we get patients mostly at the later stages. So once it's very much advanced, and all right, so I assume there are no more queries right now, and yeah, so we could be ending the session in few minutes. If there are any other health queries, please make sure that you post it in the app, Ayurdynamic app, and we'll be really happy to help you with any of the health concerns. All right. So thank you so much for your queries. Thank you so much for joining. And please stay healthy, please stay happy, and please follow a very healthy lifestyle. So thank you so much. Thank you so much for joining. Thank you all. Okay, so 1 second. I have. Is it possible to share the recording slides of yesterday? Thanks. Yeah, the webinar will be recorded session will be posted in the app tomorrow, by tomorrow, sir. So if you download the Ayurdynamic app, the entire session would be accessible to you, so you can hear the session again. So henceforth, we are planning to post all the recorded sessions there. And all right, so thank you so much. Thank you so much for joining. It was a pleasure interacting with all of you.